Okay, here we go, y'all. It is Monday, I think it's July 27th. Yep, July 27th, 9:30 a.m. It's nice and rainy and not horribly hot. Um, so let's jump right in. So this is going to feel a little touchy-feely to some people, I suppose. And we're going to talk about grounding, also known as earthing. Been around 10 or so years, maybe 12. And it's an interesting concept. Whether you believe it or not is up to you. Certainly not recommending this, but it surely can't hurt you. So basically, we've talked a lot about inflammation and oxygen reactive species and how they have little charges on them. And so the theory behind a lot of chronic illness is chronic inflammation. And we've talked about how during normal cellular processes in the body, you will create free radicals or reactive oxygen species. And so a lot of the treatments, well, a lot of the ways to avoid that or to decrease your chronic inflammation is to take things that will donate electrons to a positively charged reactive oxygen species or a free radical. So vitamin C, vitamin E, coenzyme Q10, all of those can donate electrons. And so if you have a positively charged proton like hydrogen, and you combine that with so two hydrogen positive charges combined with an oxygen that donates two electrons, you get water, H2O. So that's kind of the basis of the electricity that's involved with chronic inflammation. Okay, so I took when I was at St. Louis University, I took physics, and we had a huge part of the second trimester that was on electricity and electrophysics. I barely got through that class. I got a B, but I do not understand electricity at all. It's kind of one of those topics that I don't get. So for me to talk about electrical charges and all that is a little bit out of my league, sort of. So earthing or grounding is totally natural. And if you listen to me at all, we try to figure out natural ways and supplemental ways to heal you without having to be pharmaceutically drug dependent. And so that's after me 30 years in the allopathic medicine sphere, where I wrote a lot of pharmaceutical prescriptions. One of the things we're going to do later this week is 50 facts about statins and cholesterol. So either Wednesday or Friday, I ran across a guy that came up with 50 facts. Some of them I've already told you in May, but he has some more interesting things. Okay, so the surface of the planet, okay, the Earth, has subtle electrical frequencies, and they are negatively charged. See, the Earth is technically a negatively charged entity, and so if you're running around with chronic inflammation reactive oxygen species, you have a lot of positively charged things in your body. So the idea behind connecting to the Earth is to balance out that electrical difference. Okay, so connecting the human body to the Earth is pretty simple. Just go barefoot. But you do have to touch the Earth. So that sounds weird. There is some science involved, not a whole lot, and most of it isn't technically as well, I guess, not developed, as well designed as a typical medical study would be. But of course, there's no drug involved, so there's no money involved with pharmaceutical research, right? Okay, so if you've ever walked along the beach, been in the sand, been in the salt water of the ocean, walked across a grassy field with morning dew on the surface, if you've done that, most of you can tell that you feel a certain energy, almost a warming or maybe a tingle from being in contact with the actual earth, whether that be grass or whether that be sand or whether that be the ocean with the salt water or whether that even be rocks and dirt. So you can connect to that energy by sleeping, working, sitting, um, different grounding techniques, or you can just take a walk outside barefoot in the grass. So, yes, there are things that you can buy, specially designed little conductive sheets you can sleep on, and bands or mats that transfer the energy to your body. And some of the research has been done on those, and some of the research has just been done with, just people that are interested in trying to figure out if that actually makes a difference and how you prove that. Okay, so what the anecdotal stuff, people that do this and tell stories about it, usually involves common health problems and chronic pain. So recovery from surgery and injuries, extreme athletic performance, recovery is accelerated, sleeping better at night, falling asleep, waking up with more energy. Basically, overall, they just feel better. Okay, so how did they find this? And I've got to flip around a little bit. You'd think 1, 2, 3, 4, 5 would be in numerical order, and it's not. Okay, so connectedness with the earth has been around for centuries, right? So the credit for this goes to a guy who was in the cable television industry in 1993. He got out of the cable industry because of a chronic, almost a fatal illness. Not important to delve into that. But he noticed that while working, and if you go back in time, most of the shoes that we wear do not conduct electricity at all. Of course, you wouldn't want that if you stepped on a wire, right? So most of the shoes used to have leather soles. Now they're synthetic, they're plastic, they're all kinds of different things. So he got wondering about this guy. His name's Clint Ober. He was wondering if the footwear was changing or insulating people from the electrical surface charge of the earth. Okay, so he got thinking about his cable television experience. And if you remember, and you're old enough to remember, before you were connected to cable, television screens typically had a lot of snow and disturbance from electromagnetic interference, which disappears if you connect to a cable because it's grounded. So it shields that from extra signals and the fields that interfere with transmission through the cable. Okay, so this guy had a personal interest in health because of chronic back pain. Took a bunch of painkillers. I'm sure you've heard the stories from people you know, and I've heard it from patients. I have to take this in order to fall asleep. It's usually a narcotic or it's a benzodiazepine. And he was taking narcotics to even function through the day. And so he got thinking about electricity and conductivity, and he did a simple little experiment. So he rigged up a conductive grid with metallic duct tape to fit on his bed. So he clipped a wire to that, ran it at his bedroom window, fastened it to a ground rod that he put in the earth, and lay down. He laid down on that, and he promptly fell asleep. And he woke up the next morning. He'd slept soundly, hadn't taken anything to go to sleep. And so he did that for about a week, and he noticed that his chronic back pain had decreased. So he was kind of impressed with that. So he told some friends of his. He rigged up the same little crude thing for friends of his, and lo and behold, people that had chronic pain had a reduction in their need for painkillers, and they actually were sleeping better soundly through the night just by doing that. So he thought he was onto something. Started looking around, no medical research of any kind on that. Nobody in any of the researchers, physicians, all that he talked about had any interest whatsoever in figuring this out. So he decided, sorry, he decided to do his own little scientific experiment despite the fact he really didn't have any scientific training. So there's where I'm saying, this is way back in the 90s. And then since then, there's been research done on it, but again, there's not a huge amount of money that's available to do really well-controlled randomized trials on something as simple as transferring electrons from the earth into your body to decrease chronic inflammation. So there was a doctor in Southern California, very skeptical. He decided, well, I'm going to do an experiment or a study to prove that this is not true. It doesn't make any difference at all. And what he found was that not only did sleeping grounded improve sleep and pain, it also did it within a few days. So the anecdotal stories for most people that proclaim that like this is the greatest thing ever for reducing chronic illness or the symptoms of chronic illness is that it happens almost immediately. So objective measurements this physician did, and he showed a reduction by doing pre and post blood levels of cortisol, that cortisol levels decreased. And of course, cortisol is the stress hormone. So anybody that has chronic inflammation, chronic illness, anxiety, you name it, that cortisol is going to be involved. So these people were reporting less anxiety, less depression, basically less stress. And so there's studies that have been done since that time that kind of support this. Again, not well designed and not well funded. Okay, so typically, this guy kind of keeps getting involved in how this research goes, and so he kind of teamed up with some other doctors to see if there was something to this. And over the last 10 years, there seems to be some important developments. Okay, I'm trying to find part 4 that I'm after. Somehow I've managed to make it disappear. There it is. Okay. So there's, and I'm not going to name a bunch of names as far as physicians and all that are involved in this, but there are physicians that are involved in helping develop this guy's idea. Okay, so this one physician would take, he was from the New England area, and he would go to Florida for a couple of months every year and go fishing. So he would do that for about 2 months. And he noticed he had psoriasis, and he noticed that his psoriasis would usually disappear and stay disappeared for a few weeks, even after he got back to New England. So he kind of thought, well, that's from being in the sun, vitamin D, salt water, minerals, etc., and decreasing the stress from being in practice. Then he met this guy, and he realized, okay, so basically I'm grounding myself, I'm doing earthing, because he's barefoot in the salt water. And so he's basically treating himself without realizing he was treating himself. And then he noticed that other patients of his, he was a cardiologist, if they went to vacation on a beach or they were out in nature, that a lot of times if they were on blood thinners, that he had to reduce, so he would do his PTTs, routine blood work, when they came back and realized, okay, they don't need as much blood thinners. And of course, people who've had heart attacks and strokes are usually on a blood thinner, Coumadin usually. Now it's Plavix. But the coagulability of their blood had changed, so he had to basically change his treatments on people that had gone to beach areas and been in contact with nature. Okay, so then the same guy got involved with some other physicians, nurses. There was an attorney, a personal trainer, and he basically did his own little experiment on blood coagulability. So he looked under the microscope, And he had 12 people. And they did a blood smear and found, like most people do, they've got little clumps of blood, and that's how, clumps of red blood cells. And so the whole point behind Coumadin and heparin and all that is to thin the blood so that clumping doesn't happen. The clumping and the coagulability, higher viscosity of blood, it can be dangerous if you have the risk factors for heart attack and stroke. So they did this grounding technique, earthing, and 30 minutes later drew blood again and compared them under the microscope. So I'm looking at the pictures, and the red blood cells don't clump at all after that simple little 30 minutes of grounding. Okay, they've also done thermographic studies for people that have had chronic inflammatory arthritis, diabetic skin problems, etc. Thermography is basically a computer-generated image that looks for heat. And of course, inflammatory stuff is heat, right? It's one of the ways that people that don't want to have mammograms can do a breast thermogram. And of course, cancers have a lot of cell turnover, so they heat up. And if there's a little clump of cancer cells, that'll show up on a thermogram. Well, you can do a thermogram of the whole body. And so did another experiment using thermography for a person who had arthritis and hip pain and knee pain, showing a bunch of inflammatory heat, and then 30 minutes of earthing and grounding, and doing another thermogram where all the heat is dissipated. So something that fast and that simple. So I told you this was going to be a little touchy-feely today. So it's controversial. So I'm going to go to, what is this? What's the science? Okay, critics of this say there's a lack of solid scientific studies, blah, blah. So basically, you're putting your body in direct and uninterrupted contact with the earth, whether that means you're walking barefoot or you're lying on the grass, but it has to be skin. So skin touching the earth, or you can do these mats and bands and all that kind of stuff. There's shoes. I found, Amazon has earthing shoes or grounding shoes that you can walk on. So the idea is that the earth has a mildly negative charge, and over time, because of life, you build up in your body a slightly positive charge from those free radical species. Okay. And if you don't have any contact with the earth, which is kind of most of us, I got thinking when's the last time I walked barefoot out in the grass? It's been a while. I just laid in the grass or went swimming in a salt water, in an ocean or whatever. Haven't done that. So we wear rubber shoes. We're indoors most of the time, especially during a pandemic where we're socially isolated and we're just hanging out at home. So over time, the theory is that positive charge leads to health problems, and there's basis for that. So the deeper science is you get the reactive oxygen species or free radicals during metabolism. Okay, those species can attack and destroy unwanted things within the body, like bacteria and viruses. So you do need some free radicals. What you don't want is a whole bunch of them. So too many of those are implicated in chronic disease, and they also happen with aging. It's part of the aging process, and that's also involved in inflammation. Okay, so if you have an inflammatory condition that you need to get rid of, like coronavirus, you need some immune inflammation, get rid of this invading pathogen. But if you have low-grade inflammation through your whole body, that is the theory behind chronic pain, muscle pain, joint pain, chronic pain, as well as heart disease and type 2 diabetes. So we know heart disease and type 2 diabetes is involved or comes about because of chronic inflammation. Okay? So the free radicals don't have an electron, so you want to give them electrons. So that is from nutrients. You can eat them, plant-based substances, vitamin A, vitamin C, vitamin E, polyphenols like tea and coffee, cocoa, apples. And then I always mention coenzyme Q10 because there's two things it does. It improves the contractility of the muscle of the heart, and it scavenges free radicals to get rid of them in your body. Okay, so the idea behind this is the other way to get the electron donation is from Mother Earth. Okay, so what are the benefits? Okay, emerging research, and this is from 2019. So I went back in time to 1993, then to 2008, then 2010, then 2012. Now we're at 2019. So the developing research, again, not well designed, but it's there, is that earthing may be beneficial to reduce inflammation, to reduce chronic pain. It tends to improve sleep, which is your healing time. That's when you're making your hormones, and that's when your immune system is rebuilding and you're healing your body. Earthing tends to increase energy. This is anecdotal. Lowering stress, more calmness, decrease in cortisol levels. That's been shown by blood tests. Normalizing circadian rhythm and biologic rhythms. Normalizing blood pressure, normalizing blood flow. Relieving headaches and muscle tension, so chronic headaches and chronic myalgia or fibromyalgia. Improvement in menstrual and female hormone symptoms, so premenstrual syndrome, perimenopausal syndrome, all that. Speeds the healing process of the skin. So this has been used, these mats have been used in nursing homes to prevent bed sores. Reducing jet lag, protecting the body from electromagnetic fields. We're surrounded by those with cellular towers. They do have an electromagnetic field. We're not going to get into that conspiracy on 5G, but there is an electromagnetic field. And then shortening recovery time from injuries, whether that be a strenuous physical workout or an injury, reducing snoring, and helping adrenal health. So the adrenal gland is where your stress hormones are from, cortisol, etc., and all the steroids. So the controversy is really there's no data to back that up. Critics also say it could be dangerous. Now, that doesn't make any sense to me because I don't think I've ever been injured, unless I twist my ankle, walking barefoot in the grass. When we were kids, we walked, I lived on a farm. We were out in the front yard all the time, playing with the dogs, riding the ponies, hanging around. We were barefoot all the time. I don't remember being injured or ill, or, I mean, I'm not saying that me doing that as a child has kept me healthy, but for almost 60 years old, I really haven't, except for blood pressure, I haven't really had any major health issues, and I haven't lived a clean life, trust me. Okay, so there's a couple of small scale studies. One study examining 60 people with chronic pain and sleep troubles. Half slept on a grounded sheet, the other half slept on a placebo sheet. The ones who slept grounded reported a reduction in chronic pain. They were breathing easier. They had less arthritis. They had less apnea, and their blood pressure was lower. Another, even smaller study showed a reduction in blood viscosity, so coagulability. So hyper high coagulability is a risk factor for stroke and heart disease. Okay, so that little 12-person study that was done showed that under a microscope. Pretty easy to see, even if you don't know what red blood cells look like under a microscope. So again, thermographic images have been shown usually within 30 minutes, where you're decreasing the heat of inflammation and chronic inflammation like arthritis. And so it's an interesting little story and an interesting little way of perhaps improving your health. So we know, like I said in the hour ago picture I put up, walking is one of your best exercises. I always tell people, you don't need to run a marathon. You don't need to bench press 300 pounds. You just need to move. As we get older, that's even more and more important to get rid of that stiffness in joints, etc. So if you're moving anyway, kick your shoes off and walk through the grass while you're walking well, I guess if you're walking a dog, you might step and poop, but that's true with shoes too. But, if nothing else, go sit out side, take your shoes off and put your feet in the grass. Cheap, not going to hurt you, might help you. Buy a mat if you want, buy some shoes if you want. But connecting with the earth, we got the time right now. So it's worth a shot, don't you think? So what we're going to do is end today, okay? And then, so I did it in 25 minutes. I wasn't sure I could do that. I've got 50 facts about statins, cholesterol, and heart disease coming up, and I've got one other thing that I'm kind of working on. So I will see you on Wednesday. Have a great day. It's nice and cloudy and kind of rainy here, so I hope it's not blisteringly hot where you are. And I'll talk to you Wednesday. Peace and health to all of you. See you later. Bye.